Hi, this is Manoj Motwani, and this is the video abstract for the incidence of posterior ocular astigmatism in a refractive surgery population as determined by the direct reduction of topography measured astigmatism. This is a paper by myself, Manoj Motwani, and Lourdes Haydaw. This is a retrospective study that examined 1,500 eyes that had topography guided ablation, utilizing topography measured astigmatism and axis in its surgical planning. And then we looked at every inaccurate outcome of those eyes to look for cases that had posterior ocular astigmatism. The methodology of this was to essentially use topography afterwards to determine if the astigmatism on topography was removed and we still had refractive manifest astigmatism. If then we were to apply using a wavefront optimized procedure to reintroduce astigmatism back on the cornea to cancel out and get a plano refractive manifest astigmatism, then we would know that we had actually had posterior ocular astigmatism that we were actually canceling out. Out of the 1,500 eyes, 44 were confirmed to have posterior ocular astigmatism by this direct criteria, resulting in an incidence of 2.93%. The average amount of astigmatism in these eyes post-primary procedure was just over a diopter, about 1.13 diopters. The average topography measured astigmatism after the primary procedure was 0.39 diopters. After the secondary enhancement with wavefront optimized ablation, the average amount of postoperative astigmatism was 0.01 diopters, and the average amount of topography measured astigmatism was 1.1 diopters. So essentially, the average amount of topography measured astigmatism after correction to get plano refractive manifest astigmatism was the same amount as post-primary correction. Interestingly, we also measured HOA, high order aberrations, and those were reduced overall by about 9%. That incidence of 2.93% is lower than what's been calculated in the past as an incidence on studies. We were able to correlate this with other studies, but there are no other studies showing a direct reduction of topography astigmatism to look for posterior ocular astigmatism, or what can also be called as ocular residual astigmatism, or ORA. In conclusion, when posterior ocular astigmatism is measured in a procedure directly reducing topography guided astigmatism to look for refractive manifest astigmatism and then treating that to put astigmatism back on the topography in this direct manner, the incidence was 2.93% and is lower than prior studies.